Hi, thank you. I'm Whitney, and I'm happy to be here. It's difficult always to share your recovery story, but I believe very, very strongly that the use of medications and treatment is essential. So I'm just, as Dr. Gitlow said, I'm one of those people you may not imagine walking down the street with my toddler in tow and my husband, that I happen to be in a long-term recovery from a chronic disease, opioid addiction. My husband and I, we both work in federal policy. We've both served on Capitol Hill. We're active in our community. But it's all because of the fact that I'm in long-term recovery. And I know that a key part of my recovery, in addition to the recovery support services and the social support services, has been the use of the medication buprenorphine, an FDA-approved medication that is the gold standard of care for opioid addiction. And it hasn't always been easy. I was not an easy case. I had a very low bottom. I was homeless. I was extraordinarily sick with many health conditions related. But I was so fortunate to have a family that followed the evidence and found one of the very few providers in my state at that time, 8 years ago, that actually provided buprenorphine. I watched a lot of my peers not want to use medication, go in and out of treatment centers, and a lot of them died. I saw a lot of them go into treatment centers, were taken off of opioid treatment medications, and relapse and die. So I think in one of the hardest parts about gaining your recovery is to face additional stigma and prejudice, even within the recovery community, about the use of medications, which again have the strongest evidence base. But in addition to that prejudice, probably the biggest barrier has been my issues with my insurance company. So what my insurance company has done is arbitrarily decide limits on the amount of dosing and days that I can take buprenorphine. I also happen to be 6 months pregnant. I am under the care of an OBGYN, a maternal and fetal medicine doc, and my addiction medicine specialist. We are on a protocol of tapering my medication down so so I can have a safe and happy and healthy delivery. Now, if I were to follow the arbitrary decisions of my insurance company, I am told that I would have a miscarriage. So every month or two, my physician and I go through the process of filling out what is called a pre-authorization. And the first time this happened, we filled it out. It was a little annoying, but it got approved. The second time, took a couple times. Third time, soon we're talking about months and months of not being covered. Now, I am 6 months pregnant. I am told that if I follow the advice of my insurance company and am given the dose, what they say would be 4 days of medication, and it would induce a miscarriage. So I have to pay for my medication out of pocket. I am happy to report that recently, after a few months of again paying for my medication out of pocket while pregnant, they have miraculously approved for whatever amount of time it will be until they start requiring it again. But I mean, I had to develop a really strong relationship with my physician, and I'm grateful that this private physician who does not have administrative staff that would go through all of this trouble and all of this paperwork with me. And I know from the medical director of the organization that I work with that she can only take on so many patients because she just cannot file all of the paperwork that is necessary. So I recognize that my story is one example of what is happening all across the nation, and the amount of time that I spent and the advocacy that it took. I mean, I'm lucky that I have the resources to be able to pay out of pocket, that I have the advocacy training in order to fight my insurance company. But it pains me to think of the women out there and the pregnant women that don't have access to these services that could be putting their fetus and their own health at risk. So with that, I'll just say I hope and implore both the Medicaid system and the private insurance company to recognize that women's health, all patients' health, is not worth. It's worth getting over the ideological and opposition to medications. It's financially not worth the cost that it does to our health and our lives. Thanks.